Aneurysm is a medical condition that can be very dangerous if it bursts. In this video, we will explain what it is in very simple terms, who is more likely to get it, what medicines doctors use, and what treatments may be needed in the hospital. Section 1. What is an aneurysm? An aneurysm is when a blood vessel in the body becomes weak and starts to bulge out like a small balloon. Blood vessels are tubes that carry blood through your body. When one of these tubes gets weak, the wall can stretch and form a bump. This can happen in different parts of the body, but it is most serious when it happens in the brain or in the main blood vessel in the chest or stomach called the aorta. The danger is that if this bulge gets too big, it can burst and cause internal bleeding, which can be very serious or even deadly. Section 2. Who is more likely to get an aneurysm? Some people have a higher chance of getting an aneurysm. It is more common in older adults, especially people over 50. People who smoke have a higher risk. People with high blood pressure are also at higher risk because it puts more force on blood vessels. Having close family members who had an aneurysm can also increase risk. Some rare genetic conditions that weaken blood vessels can also make it more likely. In general, it is something that develops slowly over time and is linked to stress on blood vessels and overall health. Section 3. What medicines are used? There is no medicine that can fix an aneurysm completely. However, doctors use medicines to lower the risk of it getting worse or bursting. The most important medicines are those that lower blood pressure, because lower pressure means less stress on the weak blood vessel. Doctors may also use medicine to lower cholesterol and reduce buildup in the arteries. If someone has pain or symptoms, they may also be given pain relief medicine. The main goal is to keep the blood vessel as calm and stable as possible. Section 4. Hospital treatments and procedures. If an aneurysm is large, growing, or has already burst, doctors may need to treat it with a procedure. One treatment is called clipping, where a surgeon places a small clip at the base of the aneurysm in the brain to stop blood from flowing into it. Another treatment is called coiling, where doctors use a thin tube that goes through a blood vessel and place tiny coils inside the aneurysm to block blood flow. For aneurysms in the main body artery, doctors may replace the weak section with our artificial tube to strengthen the blood vessel. These treatments are done to stop bleeding and prevent serious complications. Outro. Aneurysms often do not cause symptoms, so many people do not know they have one until it is found during a scan. Even though they can be dangerous, doctors have ways to treat them and reduce risk. Getting early medical care can make a big difference. Thank you for watching.